Good morning, everyone. Again, welcome to day 2 of DS World. We are in a series of interviews with doctors who've had the privilege of checking out the Curare implant block that is officially released at DS World this week. On our guest list next, we have Dr. Jenny Apekian. She is from my hometown, Sacramento. Welcome, Jenny. Tell our viewers about your practice. Tell us about how long you've been practicing, what's your CEREC experience, and everything that I know about you. Your practice is stunning.
Thank you.
I've never been to your practice.
I cannot believe we've never been to each other's practices.
Correct. And every time I talk to someone, they're like, you're from Sacramento. Have you seen Jenny's practice? I'm like, no, I haven't.
Okay,
but,
we need to make it happen.
I think there is a strong design element to everything that you do.
Yeah.
So tell us about your practice. Tell us about your dental experience, your CEREC experience.
So I graduated from UCSF in 2007 and, like a lot of young docs got into DSO. At that time, it wasn't as common, but I got a lot of experience out of that corporate office. And 6 years in, I was ready to, take my own journey and have my own practice, and found a practice in Sacramento, kind of an urban area of Sacramento because it's close to the capital. Yeah. And it was a traditional 4-op practice. It was a dentist who, had to retire early because of a disability in his hand. And what I thought was going to be a year transition into practice ownership ended up being, a month or two. And all of a sudden, I jumped into the business of dentistry, and I didn't even know what a profit and loss statement was. I didn't know, I didn't know how to look at numbers. I didn't know how to decide if this practice was, a smart purchase. And I turned to some of my mentors to help me decide that this was, a good investment, and took the plunge into practice ownership. And it was kind of, a little dated. It was built in the 80s and it reflected that.
So did you build your new practice at the same location, or you changed locations? No.
So what happened was, one of my first purchases in the practice within 6 months of practice ownership was the CEREC. It was the Omnicam and the MCX. It was mid 2013.
Okay.
And it really changed the way I think about dentistry, the way I communicate with patients. Getting them involved in the treatment was really exciting for me. Being, someone who loves to work with my hands, I paint and I love art. And it was such an easy transition for me to go into the lab side of dentistry, because I enjoyed that all through dental school as well. And so, getting patients involved slowly but surely, patients started feeling, I think, my passion. And, all of a sudden I'm seeing these Yelp reviews and Facebook reviews and things I didn't even ask for. And so I saw the interest in the practice and started asking patients to write reviews. I made these little Yelp cards, cost me nothing. And I said, hey, if you really enjoyed your experience here today, why don't you tell your friends and family, give us a review. And I spent no marketing dollars because I had no dollars at that point. All of my money went into the tech. And slowly but surely in that old office, we became the #1 dental office in Sacramento. And you're in Roseville, so it doesn't count. Oh, so anyways, yeah. And I saw the growth in the practice really quickly. And I said, hey, how is this going to work? Because I wanted to start a family at that point. I'd recently been married and the practice was growing. We were really busting at the seams. And I said, if I want some kind of work-life balance here, I need to be able to hire an associate. But to have an associate be here long-term, it's hard to do in a 4-op practice. So I started looking around for commercial property and found one 3 blocks from that office. So which is kind of odd because it's 2831 J Street was my original location and it's 2831 G Street is my new location.
Okay.
So it was just a weird sign, you know?
It was meant to be.
Yeah. And I jumped right in, and the property is 10,000 square feet. We take about half of that down at the bottom floor and rent out the upper. And built originally a 6-op practice, and I thought, wow, this is going to be great. And I always had a plan to expand at some point. But in January 2017, we moved. We didn't equip the 7th op, but quickly in 6 months equipped the 7th op. And then, January 2020, built out 11 ops. So now we're at 11 ops in the whole practice.
The two things that I hear you say is, obviously you took control of your destiny. You reached out to patients for reviews. The positive reviews helped you grow your practice. The demand forced you to look elsewhere and open up a bigger practice, right?
Yeah.
And that is what we're looking as Syracusers is control.
Right.
Right. Now, I know you're not just a Syracuser, you're also an educator. You teach workshops on the worn dentition. So if anybody is looking to learn how to treat worn dentition, look out for Jenny's workshops. She'll post about them on Keep Cat Camming, or just check her out on social media, Facebook, Instagram. And when you teach these workshops, from what I've understood, one of the blocks that you primarily use a lot for your full mouth rehabs is KATANA, right? So before we get into this discussion about this new KATANA Zirconia One Block, tell us about your association with KATANA and how did you start using it, how long you've been using it, and your experience with it.
Yeah. Obviously, with the OmniCam and the MCX, at the time, I only had capability to do glass ceramics. And then, a few years in, I purchased the Prime Mill, and zirconia opened up for me. And I was not a believer in zirconia. It was not something, I was getting great results with what I was using. But there was one particular patient that came to me, and we had planned, she had a really significant abscess on a central, and, we grafted, we did ridge augmentation, and she didn't get a great result with her grafting. And so we talked about a bridge. And I never got the greatest embrasures with my glass ceramics and bridges. And I said, you know what, let me try this KATANA STML at the time. And I did this bridge for her that you would never know it's a bridge. It was really beautiful, and it's still beautiful today, and she loves it. She was really disappointed that she couldn't do an implant, and then when she got this bridge, she was like, this was wonderful. This was a great experience. And so when I tried it, I said, wow, the margins are just phenomenal here, and I can do these really great embrasures of the pontic and make it look so lifelike. And that natural gradient in the block, it just blocked out stumps, but still had this chameleon-like effect, which is not really common to see in zirconias. And so that kind of opened my eyes. And so I started using it for my single unit restorations. And I saw the tissue response long-term on recall, which I think, especially when I'm at sub-G margins, not ideal situations where you don't have a lot of tooth structure or you're fighting, the tissue. It just shined in those instances. And so when you compound that in a full mouth case, for instance, on patients that generally, are there for a reason, right? They're there because either they have, parafunction, or they have,
you want the strength,
or they have rampant decay, or whatever that is, you want the strength, you want the conservation, and you want the tissue response. And that's what KATANA was able to do for me. I promised
the viewers that we did not rehearse this, but you actually hit on the 3 or 4 things that is very important For this particular block, you talked about aesthetics, the fact that you use the block in the anterior zone for a bridge, obviously the biocompatibility with the tissue, but more importantly, the strength. The fact that the strength allows you to have deeper and finer embrasures, and that's where you said it did not look like a bridge, and that convinced you that it was a great material that you could use in the anterior zone, and for that matter, even when you do your full mouth rehabs, right? So obviously, all these years we've had other solutions for implant restorations. We've had blocks where you could mill a custom abutment. We've had blocks where you could do a screw retained crown. What about this particular block makes you feel good about the fact that, it's a fact, you can do everything with the block.
Right.
So how does that help your practice, not just as a clinician, but as an owner?
Right.
The bottom line, how does that benefit you?
Yeah, I'm always looking at ways to be able to provide, great outcomes, similar outcomes, but perhaps with an added efficiency, whether it's time efficiency, whether it's cost efficiencies. These are real world issues, and, practice ownership in this day and age is really challenging. And for me, the pivot was either I'm going to go down the path of, lesser products or compromised care or, shorter appointments, more patients, high volume, or I'm going to go down the road of high value, great products, but being extremely efficient. And the way that we are extremely efficient is technology. So now to have the confidence that I already have in KATANA ONE, the years that I've been using it, the recalls that I've seen now is in an implant block. We already know the tissue response to zirconia, and particularly my experience with KATANA ONE has been excellent. We know that, tissue loves titanium, tissue loves zirconia, tissue doesn't love glass ceramic, right? And we've been using glass ceramic sub-G near an implant for years. And frankly, it hasn't been terrible. But, this is the beauty of this day and age in dentistry, right?
You have more options.
You have so many options, and they're all great options. And you need to find what option works in your practice, what's reproducible, what's giving you good outcomes in your hands. And so for me, that's KATANA ONE. It's been a wonderful product on teeth, and my short experience using it on implants has been the same.
Now, as educators and long-term CEREC users, we tend to get access to a lot of these products ahead of time. We even though we might like a particular product, we tend to use a lot of different products just so that we can distill down the findings that we find and hopefully teach it at courses or, bring it to the audience that we kind of represent in the community. And when you look at this particular block, do you see additional benefits that were not present with similar solutions for implant restorations in the past?
Yeah, now we're seeing some hybrid abutments, zirconia hybrid abutments, but that was not possible just a few short months ago, right?
From the same block.
Yeah, exactly. Being able to complete hybrid abutments. For example, my go-to has been screw retain restorations for every implant that
Whenever
I can possibly
possible.
do it, right? And my patients have become quite accustomed to same-day dentistry, right? But I wasn't really doing that in the anterior area because of positioning and so on. So if the position is possible, now we have this really aesthetic zirconia restoration that we could possibly, mill chair side and deliver same day. So that's a really interesting way to approach implant restorations where we were not able to do so before.
Okay. Well, tell us about the fit of these zirconia implant restorations after milling. Tell us about the fit to the tie base. Tell us about what is so good about the fit of the cemented crown to the custom abutment if we were to do so.
Yeah, the fit to the tie base, obviously
Pre-milled?
it's pre-milled. It's an intimate fit, so there's no issue there. I'm still shocked and amazed that you can mill something 25% bigger and then sinter it and it fits perfectly. Like, I don't know, these basic things are just so amazing.
25 or 24.87
24 point something. Yeah, let's just round up.
25.
And so it's pretty amazing that you can have that intimate fit and then actually get a outcome that you designed and have that be a precise experience. But yeah, I've had great experiences so far. We polish the collar of the restoration. If it's in the anterior, we might glaze it. If not, generally the polished katana looks beautiful. So it's been a nice, added value to the practice for sure.
Okay, wonderful. What other questions do you think new users, people who want to probably try out this new block might have about the block that you may want to answer?
Understanding screw retain restorations is really important. You do an excellent job with your course, your implant restorations course, at helping people be successful. Because not every case is appropriate for a screw retain, but sometimes there are cases that are not appropriate that you can make appropriate with some simple techniques and just being more aware of implant positioning and so on. I think that as far as a restoration material, zirconia is a great, option for our implant restorations. And KATANA ONE in particular is just that. The aesthetics are just on point. They're just beautiful. And in a day and age where patients are expecting both function and beauty, it's offering both of those things really adequately.
Tell me about the split in your office. Like, how often out of 10 restorations that you do, implant restorations that you do, how often do you do screw retained? Mm-hmm. And how often do you split them into a custom abutment and a cemented crown?
It's probably 50-50.
Okay.
Because when we get to the anterior region, it's harder and harder to have a proper access hole.
All the time.
Yeah. And so, and then sometimes in the posterior region, if I'm getting it back from, a specialist, let's say, and it's not positioned exactly parallel, that might be a little challenging. So
that is another reason why we do our own guided surgery, right?
Exactly. So I think that's kind of the trajectory of a lot of us here, right? Like, it's not like I aimed to be, I didn't even have aspirations to place implants when I started, dentistry. It's just that I started thinking like, I can do better than this, right? And being able to control both the restorative and the surgical aspects is really liberating, right? Like, you have that control over the final outcome. And sometimes our surgery, like poor surgeries, make our beautiful restorative work not so great. And our not so great restorations might really affect a beautiful surgery, right?
True.
And so when you can have control over both of those aspects, I think that's just a win-win for our patients. But it's what was the question?
No, I was just talking about the whole the split restoration and how often do you...
Yeah, I think that it's pretty 50-50. I would say that now that we have a really aesthetic, hybrid abutment, that paired along with a varying gingival height might make me turn to more hybrid abutments.
You're referring to the true abutment,
yes.
gingival height,
yes.
tie base, and scan post options.
I think it's very unusual to have a case where I can use a GH1 tie base.
Yeah.
I think it's more common to have a GH2 or GH3 in a lot of areas.
So we're living in that golden age where options are plenty, right? We have so many different solutions that we could use from.
Right.
And there is not one thing that works all the time, right? Let me put you in the spot here and challenge you to come up with a one line, like a fun tagline if you were to promote this particular block. What would it look like or sound like?
Well, I'm going to take it from Karari. Hello, beautiful.
I love that. Okay, guys. So that was Dr. Jenny Apekian, and she is a practicing dentist in Sacramento, California. And those were her thoughts about the new Zirconia One Katana block from Cureray Dental. Thank you, Jenny.
Thanks,
And
Dhaval.
yep, enjoy
Always
the week.
a pleasure.
Thank you.